you today?
Fine, thank you.
What's your name?
Michael Baden.
Hi, Mr. Bade. My name is Nora. I'm going to be your student nurse practitioner. I'm going to be conducting a head-to-toe assessment on you today. And we're going to start with your head. First I'm just gonna inspect your head and your face. First I'm gonna look at your head. I'm gonna look at the contour of your head. I'm gonna be looking at this the symmetry. I'm gonna be looking at the contour. I'm gonna go into your hair. I'm gonna be looking at your hair distribution. I'm gonna be looking at your hair distribution. I'm going to be just touching your head here, and I'm going to be just palpating and checking for any lumps or bumps and everything. I'm going to be looking and feeling in the back of your head for any kind of lesions or anything like that. Everything looks pretty good. Now I'm going to go looking at your face. I'm going to check the contour and the symmetry of your face. I'm going to look at your eyebrows and your eyelashes for any crustiness. Everything looks good. I'm going to be looking for any kind of facial involuntary movements. Everything looks good. Okay, so now I'm going to be, and if you could please open and close your jaw for me. I'm going to be checking your temporal, your TMJ joint. Okay, it looks very good. That's good. Okay, so now I'm going to be checking your neck, and I'm going to be palpating your lymph nodes. I'm going to start by inspecting your neck. I'm going to check your trachea, make sure that there's no lumps or bumps. I'm going to be checking to make sure that it is midline. It is midline. Now I'm going to be palpating your lymph nodes. I'm going to start with your preauricular, which is in front of your ear. Then I'm going to go to your postauricular. Then I'm going to go to your tonsillar. Then I'm going to go to your precervical and your postcervical and your submandibular and your submental. Then I'm going to go back to your occipital. And then I'm going to go to your deep cervical, your deep chain. If you could just turn your neck, the best way is to feel it through your sternocleidomastoid muscle. And then now I'm going to go back to your occipital, which is scalp. Now I'm going to go to your supraclavicular, and I'm going to go to your infraclavicular. Okay. So now we're going to be inspecting your thyroid, which I already looked at your trachea, and it was good. It was midline. So now I'm going to be just feeling for your trachea, and I'm going to do this from the back. I'm just going to feel on your neck here, and I'm going to find your cartilage, and I'm just going to place my hands on both sides, and I'm going to feel for your thymus. And if you could please swallow for me. And as you do that, I feel the thymus going up and down my fingers. It feels normal. I'm going to be checking for any masses, any lumps, any goiters. Everything feels good for your thyroid. Now I'm going to be doing your eye exam. First, I'm going to inspect your eyes. I'm going to look at your lashes and your eyebrows again. Everything looks good. I'm going to be looking at your sclera. I'm going to check the color and make sure that there's no jaundice or discoloration. Everything looks, and that they're nice and white. I'm going to be pulling down to check your conjunctiva, and it looks pink. It looks good. Okay. So now I'm going to be doing your fundoscopic exam. I'm going to get my ophthalmoscope, and I'm going to be looking into your eye, but first I need to check my ophthalmoscope. I'm going to be turning it on, make sure that it turns on, that it has a light. I'm going to be adjusting it on the side. I'm going to be turning it to 0, and I'm going to be putting my hand on your shoulder, and I'm going to be holding this in my left hand, my right hand, and I'm gonna be looking in your right eye, and I'm gonna be looking from my right eye to your right eye. And as I shine the light into your eye, I'm gonna be focusing on your retinal vessels, and as I bring it in, it's gonna focus more, and I'm gonna be locating your optic disc and your cup. And as I focus more to the nasal side, I'm going to be finding your macula and your fovea. And whatever I do with the right side, I'm going to be doing on the left side. Okay. So now we're going to be doing your ear exam. First, I'm going to inspect your ears. I'm going to inspect for placement. I'm going to check to make sure that there's no swelling or drainage. I'm going to be doing what is called the tug test. I'm going to be tugging on your pillow here, peanut pillow, and then I'm going to be on adults. You tug up and up like so. And make sure that when I do that there is no pain. If there was any kind of pain, it might indicate inflammation, and it could be an ear infection of some sort. Okay, so now I'm going to take my otoscope, and I'm going to be checking in your ear. I'm going to find the right size here, and I'm going to make sure that it's comfortable, and it has to be comfortable when I put this in your ear. So now I'm going to be going inside, and I'm going to look inside and I'm going to try to find your middle ear and locate your tympanic membrane and the cone of light. And as I look inside, I see the cone of light, and I'm going to try to look at the structures of the tympanic membrane, such as the bony structures of the malleus and the umba. And I'm going to make sure that the color is a pearly white, which it is, and that it should not be red or bulging. If it was red or bulging, it might be an indication of an ear infection as well. Okay, so whatever I do on the right ear, I'm going to be doing on the left ear. I'm going to be also doing what is called a whisper test to check for your hearing. I'm going to whisper something, and you tell me what I whisper.
Apple.
Very good. And I'll do the same thing on the other side as well. If you did not hear me, we'd have to go and we would refer to the Weber test or the Rhine test for further testing. Okay, so now, with the ear test, we're going to be looking at your nose. I'm going to inspect your nose. I'm going to be looking at the outside just for any kind of swelling, lesions, any kind of with your septum, any kind of deviated septum. I'm going to have put your head back, and I'm going to check inside your nose. I'm going to do it with my light, otoscope. I'm going to check. I'm going to check your mucosa, make sure that it is not discolored or swollen or inflamed. I'm going to be checking for any polyps. And I'm also going to be checking your septum. Okay, so now we're also going to be checking your sinuses. I'm going to be checking your frontal sinuses. Any pressure there or pain? And your maxillary sinuses. Any pressure?
No.
Or pain?
What I have.
So now we're going to be checking your mouth, your lips. We're going to have you open first I'm going to inspect your lips, make sure that there is no cracking, sores or hepatic lesions. I'm going to have you open your mouth. I'm going to have you open your mouth and say ah. I'm looking inside your mouth. Stick out your tongue. Check your tongue. I'm looking in. Now open your mouth for me. Open up. I'm going to check, say ah. I'm checking your uvula to make sure that it is midline. I'm looking for any sores. I'm checking your mucosa. I'm checking your tonsils and your pillars. Everything seems pretty good. Okay, very good.
So can I stop this now?
I think, so that concludes our head and neck examination. And now we'll be going on to the pulmonary.
Keep going?
Okay, so Mr. Baden, if you would like, if you could take off your shirt for me, I'm just going to be examining your chest. Okay, first thing we're going to start with is the inspection of your chest. I'm going to look for your contour. I'm going to check your breathing, make sure that it is regular. I'm going to check your rate, that it is intact, and your breathing and your rate, and look for any kind of thrills or heaves or anything of that nature. Everything looks good. Okay, so now I'm going to check for your chest expansion. I'm going to be checking for that as well. So now I'm going to palpate your chest. I'm going to start up here, and I'm going to start up here, and I'm going to be just like that. Here. And I'm also going to be checking, as I palpate, I'm going to be checking for tactile firmness. It's a vibration in your chest. And as I put my hand on your chest, I'm going to have you say 99.
99. 99. 99.
Before I...
99. 99. 99. 99.
Very good. Okay, so now we're going to also tape your chest. I'm going to listen for your lungs. And I'm going to make sure that my stethoscope is on correctly. And then I'm going to be also taking with the diaphragm of my stethoscope. So as I listen to your chest, I'm going to do the lateral movement from side to side. I'm just going to have you take a deep breath as I do that. Very good. Okay, so now I'm going to also tape your posterior in the back. So as I do this, I'm going to do the same thing. I'm going to have you, as I touch your back, I'm just going to have you take a deep breath. Percuss your chest, and I'm going to percuss your chest using my middle finger, which is the plexometer finger, and I'm going to palpate with my plexor finger, which is also the middle finger, and I'm just going to do a lateral movement down your chest. Okay, very good. So that concludes our. We're gonna do the vocal. We're gonna do the vocal voice transmission. I'm going to be, my diaphragm. Then I'm going to put I'm going to be putting my diaphragm on your chest, on the back, and then as I do it, just say 99.
99, 99, 99, 99, 99, 99.
Okay, that is called bronchophony. It is one of 3 voice transmission tests. Now we're going to be doing the cardiac portion of our assessment today. I'm going to be palpating your apical pulse, your PMI, which is the pulse of maximal impulse, a point of maximal impulse, and it is the 5th intercostal space, mid-clavicular line. So it is, so we count down from over here, and I'm going to be palpating it, and it is less than 2.5 centimeters, which is the size of a quarter, which is normal. Now we're going to be doing the auscultation part of our exam, and before we do that, I'm going to be getting my stethoscope, and I'm going to be explaining that I'm going to be putting my stethoscope in the correct way, I'm going to be wearing it the correct way, and I'm going to be using the diaphragm and the bell of my stethoscope, and the bell of the stethoscope is used for low pitch sounds such as S3, S4, and mitral stenosis and murmurs. And the diaphragm of the stethoscope is used for high pitch sounds such as S1, S2, and aortic regurgitation and mitral regurgitation. Now, the bell is also used for extra hard sounds such as S3 and S4. Now S3 comes before S2 and S4 comes before S1. And S2 is heard loudest at the base of the heart, and S1 is heard loudest at the apex. And S1 correlates with a pulse. Now, I'm going to be auscultating your chest now, and I'm going to be starting at the aorta, which is the 2nd intercostal space, right sternal border. And I'm going to be doing that with the diaphragm. Now I'm going to be going over to the pulmonic, which is the 2nd intercostal space, left sternal border. Now I'm going to be going to the tricuspid, which is the 4th intercostal space, left sternal border. And now I'm going to be going to the mitral valve, which is the 5th intercostal space, the mid-clavicular line. Okay, so that concludes our cardiac portion of our assessment. Okay, Mr. Baden, so now we're going to be doing the peripheral vascular section of our exam. I'm going to be checking your upper extremities. I'm going to be looking at them. I'm going to be inspecting them. I'm going to be checking your temperature on both arms. I'm going to be checking your skin turgor. I'm going to be inspecting for any lesions, any discolorations. I'm going to check your capillary refill. The normal is between 1 and 2 seconds, and yours is good. Yours is normal. Okay, now I'm going to be checking your pulses. I'm going to start with your radial pulse. Very good. I'm going to be checking your ulnar pulse. Very good. Now I'm going to be going to your brachial pulse. just stretch your legs out. I'm going to be checking your femoral pulse. You just lean back a little bit. It's between here and here, between the symphysis pubis and umbilicus and right here. Okay, very good. Now I'm going to be checking your lower extremities. Again, I'm going to be looking at the temperature. I'm going to be feeling the temperature. I'm going to be checking your turgor. I'm going to be looking for your hair distribution. I'm going to be looking for any discolorations, any ulcers, lesions, etc. Now I'm going to be checking your popliteal pulse. So you'll bend your leg for me. And all of your pulses so far are normal. There are +2. And then whatever I do on this leg, I'm going to be doing on that leg. And then I'm going to be checking your tibial, your dorsalis pedis, and your posterior tibia, which is over here. Okay, and I'm going to be checking again, like I said, for any ulcers or lesions, and everything looks very good. So that concludes that portion of the exam. Okay, so now we're going to be doing the abdominal portion of our assessment. I'm just going to have you lift your top. First, I'm going to be inspecting your abdomen. I'm going to be checking for contour, symmetry. I'm going to be looking at your color. I'm going to be looking for any scars. Everything looks good. So now I'm going to be auscultating your abdomen. I'm going to be doing all 4 quadrants. I'm going to be starting in the right upper quadrant of your abdomen with my diaphragm. I'm going to be going in a clockwise direction. Okay, now I'm going to be percussing your abdomen. I'm going to start in the upper right quadrant, and I'm going to be using my left finger. I'm going to be using my right finger, my dominant hand. I'm going to lightly be percussing, and I'm going to be feeling. We're going to be listening for a tympanic sound, which is normal. I'm going to be starting in the right upper quadrant. What we heard was the tympanic sound, and that is what we want to hear when we're percussing the abdomen. Okay, so now I'm going to be doing palpation, and I'm going to start with light palpation, and this is to get the patient used to having their abdomen palpated. I'm going to be starting with light palpation. I'm going to start in the right upper quadrant, just lightly palpating epigastric, and to the left. Right lower quadrant. Okay. And now I'm going to be doing deep palpation. I'm going to be starting at the right upper quadrant, and this is by the liver, and then I'm just going to be like deeply, I'm going to put my hand deeply under your rib cage, and I'm going to be pressing in. You won't feel hopefully any pain, just maybe a little discomfort. I'm going to try to just press in deeply there. I'm going to start at that section. And I'm going to go to the epigastric area. I'm going to press there. And then I'm going to go to the left. And this is by the spleen. And I'm going to be pressing deeply. And normally, you would not, in a normal finding, you would not feel the spleen. Pressing deeply there. And I'm going to go to the left lower quadrant. And this would be around, you feel like, for the colon. Now I'm going to go go to the epigastric area. And then I'm going to go to the right lower quadrant, and this is where you find the appendix. I'm going to deeply palpate there. That's normal. Okay, that's good. And so now we're going to be going over the mental status portion of your assessment. Going to be starting out going over and assessing your speech, your level of responses, and your language and your thought processes. So after being with you so far, I observed that everything seems to be fine with your speech. Your level of response is appropriate. Your thought process and articulation is appropriate. You're oriented to time and place, and you're appropriate with your speech and language. Okay, so that's very good. So now we're going to be going over the 12 cranial nerves and assessing them. So cranial nerve number 1 has to do with olfactory, and that has to do with smell. Now, in order to test your smell, I would have you close your eyes, and I would normally take either a little bit of coffee or lavender, and I would have you tell me what it was, and you could assess the smell of lavender or coffee. Okay, that's number 1. Number 2 is See, I forgot everything. Do I start from now?
Yeah, just start to pick up from where you're at.
So number two is optic, and optic has to do with visual field, visual acuity. Visual field has to do with the finger test. Visual acuity, I would be getting the Snellen eye chart and testing your vision, and we would also do the fundoscopic exam, which we've already done in our head and neck portion. Now, that's 2. So 3, 4, and 6. So 3 is ocular motor. And ocular motor has to do with extraocular movements, pupillary constriction, and opening of eyelids. And that's 3. And 4 is trochlear, which is downward and inward. And abducens is lateral deviation. Now 3, 4, and 6 are usually tested together. And I would do that by doing the 6 cardinal views of gaze. I would go up here, down there, up there, and I would have you do that. So that's 3, 4, and 6. And then 5 is trigeminal. Now the sensory for trigeminal is ophthalmic, and it's maxillary and mandibular. Also, it includes the corneal reflex test. And in order for me to do that, I would get a little piece of cotton. I would have you look all the way to the left. I would lightly touch your cornea with the cotton, and and your response should be that you would blink a lot, and that would be the appropriate response. So that is the sensory portion. The motor portion is temporal and masseter muscle for that. Now that's 5. Also for the corneal reflex test, there's also testing. When I do that with the blinking, it also tests for cranial nerve 7. So that's 5, and then cranial nerve 7 would be facial, and the sensory portion would be tasting and 2/3 of the anterior tongue, and the motor would be to raise your eyebrows, frown, smile, close your eyes really tight, and puff out your cheeks. And that would be the motor portion of that. And that would be facial. So 8 is cranial nerve 8 is vestibular and cochlear, and that has to do with balance and hearing. And then 9 and 10 go together. 9 is glossopharyngeal, and glossopharyngeal has to do with the tongue, and it has to do, the taste part is 2/3 of the posterior tongue, and the motor is the uvula and the gag and the phonation. And 10 is vagus. Vagus has to do with, the sensory has to do with heart rate, respiratory rate, peristalsis, GI. and 9 and 10 usually go together. And also, Vegas is Latin for lazy, and it would be everything lazy except eating. So that's 9 and 10. And then 11 is spinal accessory. Now for the spinal accessory, I'd have you shrug your shoulders and move your head side to side. And then test that. And then 12 is hypoglossal. Now hypoglossal has to do with the tongue, and I would have you stick out your tongue and go from side to side and make sure that it is symmetrical. Okay, so that finishes that portion of our exam. So abdominal. So now we're going to be doing the sensory portion of our exam. We're going to start out with the sensory function. What I'm going to do is I have this in my hand. I'm going to, with your eyes open, I'm going to show you that this part is soft and this is sharp. And now close your eyes and you're going to tell me, what does that feel like?
Soft, sharp.
Okay, very good. And I would be doing that on both sides and on your upper and lower extremities. So that's the sensory part. And now we're going to be doing the position sense. So I'm going to be taking your finger. I'm going to be holding it on the side, not over here, because that puts too much pressure. I'm going to be taking it over like this, and I'm going to be going like this up. And now I'm going down, and close your eyes. So what is it?
Up,
And what is that?
down.
Okay, very good. So that I'm also going to be doing that on the both sides and upper and lower extremities. So now we're going to be doing the vibration sense, and this is for neuropathy, mostly a test for diabetics. What I'm going to do is I'm going to take my tuning fork, and I'm going to be finding your styloid, about 2 inches above your styloid. I'm going to find where the little spongy part is, and I'm going to take my tuning fork, and I'm just going to put it there, and you tell me if you, close your eyes, you tell me if you feel the vibration.
Yes.
Okay, very good. And I'm going to be doing that also on the right and left side and the upper and lower extremities. Okay, so now we're going to be doing we're going to go into the reflexes. We're going to be testing your reflexes. Before we test your reflexes, we're just going to be going over the sequence of diminished reflexes and what they mean. So for the ankle, if you have a diminished reflex, that would be indicative of a lesion in C1. If you were to have S1, I'm sorry, excuse me, that would be indicative of a lesion in S1. If you were to have a diminished reflex in your knee or patella, that would be L2 to L4. If you were to have a diminished reflex in your radialis or biceps tendon, that would be C5 to C6, and in your triceps tendon, triceps air reflex, that would be C6 to C7. And that would be indicative of diminished reflex, and that would be where the lesion would be. Okay, so now that we went over that, we're going to be doing if you can stand up for me, I'm going to have you turn around and lean your knee on the chair, so we're going to be testing your ankle reflex. Okay, I'm going to go to your Achilles tendon here, and I'm just going to be tapping over here. Very good, and the expected finding is plantar flexion and calf contraction. Okay. So that's your ankle. Now we're going to be doing your knee or patella, so have a seat for me. I'm going to have you kind of just put out your knee like that. I'm going to be finding the area to tap right here, the patella. Very good. Okay, and that would be, and the expected finding would be knee extension. Okay, so now we're going to do your brachial radialis, and then I'm going to be holding. I'm going to be over here. I'm going to find your area right here, and I'm going to be tapping, and that's about 2 inches above the styloid, and I'm going to be tapping, and the expected finding would be flexion of the wrist, and supination of the hand. Okay, so now we're going to be testing your biceps, and I'm going to be finding your brachial tendon here, and I'm going to be hitting my little reflex hammer on my thumb, like so. And what we're going to expect is bicep contraction and elbow flexion. So now we're going to be testing your triceps. So I'm just going to hold your arm up like so and just let it fall. Don't help me because it needs to be heavy on my arm. So we're going to do like this. I'm going to do like this. And then I'm going to find your olecranon process, and I'm going to go over here and just kind of like turn your head so you're not paying it, so then you just rest your arm. Very good. Okay, and the expected finding is elbow extension and tricep contraction. Okay, so now we're going to go into going to test your upper and lower muscle strength. I'm going to take your arms like so, and I'm just going to press on them like this, and I'm going to go like this, and I'm going to test your strength. And then I'm going to take your fingers, and test your adduction and abduction. So I'm just going to pull on that, kind of just straighten them, and just test the strength. And I'm going to be doing it on the other side, testing the strength of your abduction and adduction, and that's good. And then now I'm going to be going to your lower extremities, and I'm just going to be pushing on your legs, and just push up for me. Very good. And push straight, and push. And we're going to be doing the right and the left side. Okay, so now we're going to be doing your upper and lower coordination. So I'm going to be doing your upper and lower coordination. So I'm going to take your fingers, and I'm going to have you touch your nose. I'm going to have you close your eyes and touch your nose and touch my finger. And then keep going, and then like each finger. Well, open your eyes. Just touch my finger to your nose. There you go. And then that one, that one, that one, that one. Perfect. And what I'm testing for is smoothness and accuracy. Also, you can go like this with your fingers. You can touch each one to your fingers, and I'm going to be testing for smoothness and accuracy. I'm going to be, and on your lower extremities, if you could take your ankle and just put it up like this with your knee, and just slide it down, like this with your knee, and just slide it down like this, or like that. Very good. And do the other side. And what we're looking for is smoothness and accuracy. Okay, so now we're going to be doing the Romberg test. I'm going to have you stand up. I'm going to have you face me, and I'm going to have you with your palms up, and I'm going to have you close your eyes. And I'm just going to have you stand there for maybe 30 to 60 seconds. And I'm going to be testing your balance. And very good. And now I'm going to be doing the pronation drift. So we're going to just have your hands pronated. And I'm going to press on your arms, like so, down. And I'm going to check that your arms come up to where they were. So I'm going to go down. And the expected finding is that your arms come up to where they were, and they do not drift or sway. Okay, so now we're going to be testing, we're going to be doing something called the graphesthesia test and the stereoagnosis. We're going to be doing the stereoagnosis, and that's where I'm going to be putting something, close your eyes, I'm going to be putting something in your hand, and you tell me what it is.
I'm a key.
Very good. And whatever I do on the right side, I'm going to be doing on the left side. And now we're going to be doing something called the graphesthesia test. I'm going to be close your eyes. I'm going to be writing a number in your hand, and you tell me what it is.
3.
Very good. Now this test, if you weren't telling me the correct thing, it would maybe mean that you have an issue with your sensory cortex. Okay, so now we're going to be testing your gait. We're going to have you walk I'm gonna have you walk back and forth, swing your arms. Come back. I'm gonna be checking for your balance, your symmetry, that you properly swing your arms, and that you're smooth when you turn around. So now please, if you could walk with your heel to toe, like this. And then after that, we're gonna have you walk tippy toes. Go on tippy toes, that's not tippy toes, tippy toes like this.
I haven't come back yet.
Oh, I'm sorry. Okay, tippy toes. And now we're gonna have you walk on your heel. Okay, and now we're gonna have you do a shallow knee bend. Like this. Shallow knee bend. Shallow knee bend. And now we're gonna have you hop. And then the other side. Very, very good. Okay, so now our last test. Now, I'm just gonna have you sit up, stand up actually, without touching the armrest. Very good. Okay. Very good. I'm gonna have you tell me if you feel 2 points or 1.
2.
Okay.
2.
Very good. And we're gonna do it on the distal finger, and this is gonna test for any kind of distal trauma to your fingers or paresthesia of any kind of that nature, or any kind of, like, you hurt your fingers in any way. And you do it distally because the more medially you go, you're not going to be able to feel it. So, and then now we're going to do something called, the last test is going to be something called a Babinski test, and I'm going to be looking at your feet, and I'm going to go up your foot and watch how your toes react. Very good. Very good. And you curled your toes under, that is the expected response. If you fan them out, that is not normal. Okay, so that concludes our test for today. Thank you so much, Mr. David.
You're welcome.